Welcome to this Oncology Data Advisor interview, which today we're having in honor of both Melanoma Monday, which is on May 5th, and Melanoma Awareness Month, which is being observed throughout the entire month of May. And I'm joined by our editorial board member, Dr. Matt Hadfield, who is a medical oncologist at Brown University, who is here today to tell us some more about being aware of, the importance of being aware of melanoma, as well as some ongoing investigations in the field. Dr. Hadfield, thanks again for coming on today.
Thank you for having me.
So to start off, I would like to give us a little bit of an overview of sun safety and the importance of keeping this in mind during Melanoma Awareness Month.
Yeah, I think so. As we go into the spring and summer months, lots more time out in the sun, lots more time out in children activities, people going to the beach, things like that. We're in Rhode Island, so the beach is a big thing. It's always important to remember to wear sunscreen to keep your body covered up as much as possible. Unfortunately, one of the things that we've been tracking epidemiologically over the last several decades is that the incidence of melanoma is increasing. So a lot of that is most of that is related to sun exposure. So trying to be vigilant about wearing sunblock, even when it's cloudy. UV light, which is really what we're most concerned about, is still very prevalent and can cause sunburns. So you want to avoid that as much as possible.
Definitely important to keep in mind, especially its timing with Melanoma Awareness Month being in May when it's starting to get warmer and people are starting to be outside more.
Yeah, no, absolutely.
So what are some things that people should keep in mind and be concerned about as far as skin changes if they do notice something?
So I think we like to think of the ABCDEs of melanoma, and this is another timely conversation because I was actually just speaking to one of my colleagues, another melanoma physician that I work with, about how the incidence of referrals for melanoma goes up quite a bit this time of year because people are starting to wear tank tops, shorts, things like that, and people notice concerning skin lesions. So if you see something that's concerning, always talk to your primary care physician, a dermatologist. Go see someone. Don't it's better to have them say, okay, this is nothing, as opposed to it being something serious and you not getting a follow up quickly enough. But in terms of the ABCDEs, the first would be A, is asymmetry. So if you notice that a mole is different on one side versus the other, and it's not completely round or completely symmetrical, that's a sign that it may be a malignant lesion. On that same topic, B is border, so uneven borders. So anything that's kind of not symmetrical or has unevenness to it, definitely something you want to get checked out. C is color. So if you see multi-colored lesions, so something that may be tan and black and it has multiple dimensions in terms of color to it, that's another sign that you should maybe seek an opinion from your physician and potentially have it worked up further. D is diameter. So if it grows to larger than 1/4 of an inch or the diameter of a pencil eraser, also very concerning. And I would say, and the final thing is evolution. So, if you see that a lesion is getting bigger, a spot on your body is getting bigger, changing, it's starting to develop new colors, it's becoming asymmetrical. Those are all the signs that you really need to seek some professional help in terms of, again, your primary care physician, a dermatologist, what have you. And I would also just say that, again, it's always better to be overcautious. So, these are things that if you see something or see someone else have something, you could say, hey, I've heard that, moles that have two colors in them can be melanoma. Maybe you should have your doctor check that out. But also, anytime you see something concerning that's new, it's better to just have it checked out, just to ensure that you're not missing something that potentially could be cancerous.
Really great to know and keep in mind. So transitioning a little bit into the treatment landscape for melanoma, what is kind of the current treatment paradigm for melanoma? And after that, what are some things that are currently under investigation or coming down the pipeline?
Yeah, so thankfully, in the field of melanoma, we have come quite a long ways in the last decade and a half. So prior to the development of immune checkpoint inhibitors, the median overall survival for patients with metastatic melanoma, meaning melanoma that's spread to other parts of your body, was less than a year. And that's improved to over 6 years now with the utilization of checkpoint inhibitors. And other developments in that space are we now use immune checkpoint inhibitors in earlier stages of disease. So when they were first developed, we used them in metastatic patients, and then as we conducted more trials and looked at them, we trickled them down into earlier stages of disease. So most recently, the Medina trial was presented at ASCO last year. This is where you give neoadjuvant or before surgery dual checkpoint inhibitors, so ipilimumab and nivolumab, one-time dose. And the data from that was 1 year event-free survival was the primary endpoint, but the data was very encouraging, and that was a paradigm shifting trial. So we are, the amount of patients that had no evidence of melanoma left after they had this one dose of ipi-nivo was over 50%. So we're curing many patients with melanoma and making lots of advancements, and now even patients with stage 2B and 2C get adjuvant after surgery immunotherapy, depending on a risk-benefit conversation with your physician. So we've made lots of progress. There's lots more to do. A significant amount of patients are still refractory to immune checkpoint inhibitors in the frontline setting, primary resistance. Half of those patients have BRAF mutations, for which we have targeted therapies, which are also very effective, but half of them do not. So there is lots of really exciting new therapies being developed. Of those, T-cell engagers, where you have an antibody that binds a specific protein on the cell surface and hones T cells to that area. There are, FDA approved T cell engagers, but there's also many in clinical development now in phase 1 through phase 3 trials that will likely be very important for melanoma patients. And also new checkpoint inhibitors, new novel innate immune agonists. So different ways to try and overcome that therapeutic resistance and resensitize tumors to your own immune cells is continues to be a very important thing that we're working on in melanoma. And I would just say too, to kind of like cap talking about therapies, always very important to talk to your oncologist about these things. So the landscape of treatment for all cancers, including melanoma, has changed dramatically. And we are now finding benefits in earlier treatment after surgery for earlier stages of disease, like I was saying. And also prior to you having a surgical resection in some cases with stage 3 melanoma. So, it's important that you know these options are available and are something that you should have a risk benefit conversation with your physician about whether or not it's right for you, and understanding the potential benefit of receiving those therapies, because it has changed the landscape quite a bit in the last 10 years.
Great to hear. Really exciting that there's been so many huge developments in the space in the last 10 years and still more to come. So as we wrap up, sorry,
it's very exciting. It's a very exciting time to be in melanoma. I mean, we have a lot of progress still to make, and I would say the one of the best things we can do is encourage sun safety so that you never have to meet me. But it is very exciting for all the developments that we've made.
Definitely. So as I wrap up today, any parting messages you'd like to share in honor of Melanoma Monday?
I think it's very humbling taking care of patients with melanoma. As we were talking prior to this conversation, I've met recently several younger patients with melanoma. So I would say it's never too early to be concerned about something. It's never too early to go talk to your doctor about something. Better that they say, "Oh, this is nothing to worry about," as opposed to you developing something, a cancer that could have potentially been caught earlier. And thanks to the patients that we do treat and graciously agree to go on clinical trials, we've developed lots of new therapies, but we have long ways to go. But I think it's good to enjoy the summer, but just be safe and try and avoid the sun too much.
Great to know. Well, awesome. Thanks so much, Dr. Hadfield, for coming on today to share these developments with us and help us celebrate Melanoma Monday and all the research that's being done in this field and the reasons for maintaining hope in spite of everything.
Oh, thank you so much for having me.